Welcome to Pediatrics for Mothers YouTube channel, the channel dedicated to helping moms navigate the exciting, but the often overwhelming world of raising children. Our mission is to provide informative and engaging content on topics related to child health, development, and parenting. If you're interested in learning more about child health and parenting, we invite you to subscribe to our channel. By subscribing, you'll never miss an episode of our informative and entertaining content. And if you find our videos helpful, please like and comment to let us know. We always appreciate feedback from our viewers, and we're always looking for new ideas for future videos. Thank you for joining us on this journey, and we look forward to sharing our knowledge with you.
Autism in childhood is a neurodevelopmental disorder that affects an individual's ability to communicate, socialize, and interact with others. The symptoms of autism can vary from person to person, but may include difficulties with social interaction, communication, and sensory processing, as well as repetitive behaviors and adherence to routines. Autism is often diagnosed in early childhood, although some individuals may not receive a diagnosis until later in life. The exact causes of autism are not fully understood, but research suggests that both genetic and environmental factors may play a role. Early intervention and therapy are key components of effective treatment for children with autism. These may include behavioral therapies, speech and language therapy, and occupational therapy, among others. By providing early intervention, children with autism can develop the skills and abilities needed to reach their full potential and lead fulfilling lives. It is important to recognize that every individual with autism is unique, and may require different types and levels of support throughout their life. Advocacy and support can help ensure that individuals with autism have access to the resources, services, and opportunities they need to thrive. By promoting awareness and understanding of autism, we can help break down barriers and foster a more inclusive and accepting society for all. Autism spectrum disorder, ASD, is a developmental disorder that affects communication, social interaction, and behavior. It is estimated that 1 in 54 children in the United States has ASD, with boys being 4 times more likely to be diagnosed than girls. Early diagnosis and intervention are crucial for children with ASD to improve their communication skills and overall quality of life. Early signs of autism in children can be noticed as early as 6 months of age, although most cases are diagnosed around 2-3 years of age. Here are some common early signs of autism in children. 1. Lack of eye contact. Children with autism may avoid eye contact or have difficulty maintaining eye contact with others. 2. Delayed speech and language development. Children with autism may have delayed speech and language development or may not develop language at all. 3. Repetitive behaviors. Children with autism may engage in repetitive behaviors such as hand flapping, rocking back and forth, or repeating words or phrases. 4. Difficulty with social interaction. Children with autism may have difficulty engaging in social interactions with others, such as playing with other children or making friends. 5. Sensory issues. Children with autism may be hypersensitive or hypersensitive to certain sensory stimuli, such as loud noises, bright lights, or certain textures. 6. Restricted interests. Children with autism may have very specific interests or obsessions and may become upset when their routines or interests are disrupted. It is important to note that not all children with autism will exhibit all of these symptoms, and some children may exhibit different symptoms or a different severity of symptoms. It is also important to remember that some of these behaviors can be typical in children without autism, so a professional diagnosis is needed to determine if a child has autism. Diagnosing autism in children is a complex process that involves observing the child's behavior and developmental history. There is no single test to diagnose autism, but a combination of tests and evaluations can help healthcare professionals make an accurate diagnosis. Here are the steps typically involved in diagnosing autism in children. Diagnosing autism in children is a complex process that involves observing the child's behavior and developmental history. There is no single test to diagnose autism, but a combination of tests and evaluations can help healthcare professionals make an accurate diagnosis. Here are the steps typically involved in diagnosing autism in children. 1. Developmental screening. Developmental screening is a quick and simple evaluation that can be done by a healthcare provider to determine if a child is meeting developmental milestones. If a child fails a developmental screening, further testing may be necessary. 2. Comprehensive evaluation. A comprehensive evaluation involves a team of healthcare professionals who specialize in autism. This team may include a developmental pediatrician, a psychologist, a speech-language pathologist, and an occupational therapist. The evaluation may include observing the child's behavior, conducting standardized tests, and interviewing the child's parents or caregivers. 3. Diagnostic criteria. The diagnostic criteria for autism are outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. A child must meet certain criteria, such as having difficulty with social communication and interaction, and exhibiting repetitive behaviors or restricted interests, to be diagnosed with autism. 4. Differential diagnosis. A differential diagnosis is a process of ruling out other conditions that may have similar symptoms to autism. Healthcare professionals may need to rule out conditions such as intellectual disability, hearing impairment, or a language disorder before making a diagnosis of autism. 5. Final diagnosis. Once all evaluations and tests have been completed, a healthcare professional will make a final diagnosis of autism if the child meets the diagnostic criteria. It is important to note that early diagnosis and intervention are crucial for children with autism, as early treatment can improve outcomes and help children develop important skills. If parents or caregivers suspect that a child may have autism, they should speak with a healthcare provider and seek an evaluation as soon as possible. Treatment options for children with autism. There is currently no cure for autism, but there are a variety of treatment options available that can help children with autism develop important skills and improve their quality of life. Here are some of the most common treatment options for children with autism. 1. Behavioral therapy. Behavioral therapy involves working with a therapist to teach children with autism important skills, such as communication, social interaction, and self-care. Behavioral therapy can be tailored to the individual needs of each child and can be delivered in a variety of settings, such as at home, at school, or in a clinic. 2. Speech and language therapy. Many children with autism have difficulty with speech and language therapy can help them develop these skills. Speech and language therapy may involve teaching children how to communicate using words, gestures, or pictures, and may also involve teaching them how to understand and interpret social cues. 3. Occupational therapy. Occupational therapy focuses on helping children with autism develop the skills they need to perform daily activities, such as getting dressed or brushing their teeth. Occupational therapists may also work with children to develop social skills, sensory processing skills, and motor skills. 4. Medication. There is no medication that can cure autism, but some medications can help manage certain symptoms of the disorder, such as hyperactivity or anxiety. Any medication should be prescribed and closely monitored by a healthcare professional. 5. Parent training and support. Parent training and support programs can help parents and caregivers of children with autism learn how to manage their child's behavior and develop strategies to promote positive development. 6. Alternative therapies. Some families choose to try alternative therapies, such as music therapy, art therapy, or dietary interventions, to help manage symptoms of autism. While there is limited scientific evidence to support the use of alternative therapies for autism, some families may find them helpful. It is important to note that there is no one-size-fits-all approach to treating autism, and each child may benefit from a different combination of therapies and interventions. A healthcare professional can help develop a treatment plan tailored to the individual needs of each child. Challenges faced by families of children with autism. Families of children with autism face a variety of challenges that can affect their daily lives and emotional well-being. Here are some of the most common challenges faced by families of children with autism. 1. Financial burden. The cost of caring for a child with autism can be significant, as families may need to pay for therapies, medications, and other interventions. This can create a financial burden that can be difficult to manage. 2. Lack of support. Many families of children with autism feel isolated and unsupported, as they may not have access to resources or support groups in their community. This can make it difficult for them to connect with other families who are going through similar experiences. 3. Difficulty with communication. Children with autism may have difficulty communicating with their parents and caregivers, which can make it challenging for families to understand their child's needs and preferences. 4. Behavioral challenges. Children with autism may exhibit challenging behaviors, such as aggression or self-injury, which can be difficult for families to manage. 5. Educational challenges. Children with autism may have difficulty in school, which can create additional stress and challenges for families. 6. Emotional stress. Caring for a child with autism can be emotionally challenging, as families may experience feelings of stress, guilt, and anxiety. 7. Stigma and discrimination. Families of children with autism may face stigma and discrimination in their communities, which can create additional stress and challenges. It is important for families of children with autism to seek out resources and support to help them manage these challenges. This may include connecting with support groups, seeking out educational resources, and working with healthcare professionals to develop a comprehensive treatment plan for their child. It is also important for families to practice self-care and prioritize their own emotional well-being. Advocacy and support for children with autism is crucial in helping them access resources, services, and opportunities that can help them reach their full potential. Here are some ways in which advocacy and support can be provided for children with autism. 1. Education. Raising awareness and educating the public about autism can help reduce stigma and discrimination, and promote greater understanding and acceptance of individuals with autism. 2. Access to services. Advocates can work to ensure that children with autism have access to a range of services, such as early intervention, behavioral therapy, speech therapy, and occupational therapy. 3. Support for families. Advocates can provide support and resources to families of children with autism, such as support groups, educational resources, and respite care. 4. Inclusion. Advocates can work to promote inclusion and accessibility in schools, workplaces, and community settings, to ensure that children with autism are able to participate fully in all aspects of society. 5. Research. Advocates can support research into the causes of autism and the most effective treatments, to improve outcomes for children with autism and their families. 6. Legal advocacy. Advocates can provide legal support to families of children with autism who are facing discrimination or other legal challenges. 7. Policy advocacy. Advocates can work to influence policy at the local, state, and national level, to ensure that laws and regulations support the needs of individuals with autism. There are a variety of organizations and advocacy groups that work to support children with autism and their families, including the Autism Society of America, the National Autism Association, and Autism Speaks. By working together, advocates and supporters can help ensure that children with autism receive the support and resources they need to thrive. Importance of early intervention. Early intervention is critical for children with autism because it can lead to improved outcomes in their development and overall well-being. Here are some reasons why early intervention is so important. 1. Brain development. The brain is most malleable in the early years of life, and early intervention can help shape neural connections and promote positive developmental outcomes. 2. Social and communication skills. Early intervention can help children with autism develop social and communication skills that are crucial for success in school and in life. 3. Behavior management. Early intervention can help children with autism learn appropriate behaviors and manage challenging behaviors, which can improve their overall quality of life. 4. Family support. Early intervention can provide families with support and resources that can help them better understand their child's needs and provide effective care and support. 5. Cost savings. Early intervention can help reduce the need for more intensive and costly interventions later in life, which can save families and the healthcare system significant amounts of money. 6. Increased independence. Early intervention can help children with autism develop skills that promote independence and self-reliance, which can lead to greater success in school and in life. 7. Improved long-term outcomes. Studies have shown that early intervention can lead to improved long-term outcomes for children with autism, including better language and communication skills, improved socialization, and increased independence. It is important for children with autism to receive early intervention as soon as possible, ideally before the age of 3. This may include therapies such as behavioral therapy, speech therapy, and occupational therapy, as well as educational interventions and support for families. By providing early intervention, we can help children with autism reach their full potential and live fulfilling lives. Stigma and misconceptions surrounding autism are pervasive in society, and can have negative impacts on individuals with autism and their families. Here are some common myths and misconceptions about autism. 1. Autism is caused by bad parenting or vaccines. There is no evidence to support the idea that autism is caused by bad parenting or vaccines. The causes of autism are complex and not fully understood, and research suggests that both genetic and environmental factors may play a role. 2. Individuals with autism are not capable of social interaction. While individuals with autism may have difficulty with social interaction, they are capable of forming meaningful relationships and engaging in social activities. 3. Individuals with autism lack empathy. Individuals with autism may have difficulty expressing empathy in ways that are typical, but this does not mean they lack empathy altogether. 4. Autism can be cured. There is no known cure for autism, but early intervention and effective therapies can help individuals with autism reach their full potential and lead fulfilling lives. 5. Autism only affects children. Autism is a lifelong condition that affects individuals of all ages. 6. Individuals with autism are intellectually disabled. While some individuals with autism may also have intellectual disabilities, many individuals with autism have average or above average intelligence. 7. Autism is rare. Autism is actually quite common, with an estimated 1 in 54 children in the United States being diagnosed with autism. Stigma and misconceptions surrounding autism can create barriers to acceptance, inclusion, and access to resources and support for individuals with autism and their families. It is important to promote accurate information and raise awareness about autism, in order to reduce stigma and increase understanding and acceptance of individuals with autism. In conclusion, autism is a complex neurodevelopmental disorder that affects individuals of all ages. and can have a significant impact on their development, socialization, and overall well-being. Early intervention is critical for promoting positive outcomes and helping individuals with autism reach their full potential. Families of children with autism face many challenges, including navigating complex healthcare systems and dealing with societal stigma and misconceptions surrounding autism. Advocacy and support can help provide access to resources, services, and opportunities for children with autism and their families. It is important to raise awareness and promote understanding and acceptance of individuals with autism, in order to reduce stigma and promote inclusion and equality for all. By working together, we can help individuals with autism lead fulfilling lives and reach their full potential.